The debate around assisted dying is a growing one in the UK, so we've come to a country where it's been legal for over 20 years.
There isn't any debate in Holland. We are very grateful that we have this law.
I've been spending time travelling around the country to find out more, hearing from experts, doctors, and those who've been personally affected.
She decided, just let me sleep. She could, pass away very peacefully.
So what can the UK learn from the Netherlands? Both euthanasia and assisted suicide, as it's called here, became legal in 2002. Euthanasia is the practice which is administered by a doctor, whilst assisted suicide is sanctioned by health professionals and goes through the same rigorous process. The term assisted suicide differs from the wording used by campaign groups in the UK, who are arguing for assisted dying, but ultimately they are very similar in concept. But it's not as simple as everyone being entitled to euthanasia or assisted suicide. Someone who knows more is Dr. René Gieman. He's the president of the Royal Dutch Medical Association.
It starts actually with a request from a patient that he feels unbearable suffering, and he starts to discuss it with the doctor. The physician goes to the patient and they discuss actually what the request is, because it should be voluntary and well considered. And the doctor should actually really make sure that it's a voluntary and well-considered request. And in the end, the doctor should have clear that the suffering is unbearable and there is no prospect of improvement. And then the doctor says, if you want euthanasia, I'll have to ask a second opinion doctor. We call that a scan doctor. And the scan doctor goes and talks with the patient and writes a report if the due care criteria are met. And if this report is okay, then the physician can perform euthanasia according to the due care criteria.
The wording of the law here is interesting. It says someone has to have unbearable suffering with no sign of improvement. Now, for physical health conditions like terminal illnesses such as cancer, many people understand that. But there is a debate when it comes to people who have mental health issues. There have been cases of people as young as 17, women in their 20s, who've chosen to end their life because of mental health problems.
In that cases, we have a mandatory second opinion with a psychiatrist, who has to look at the psychiatric disease, at the mental disease, and must confirm that there is no other option.
The public do overwhelmingly support it. Some opinion polls put approval ratings as high as 95%. The one thing people can't agree on, though, is how far it should go. Because we haven't got it in the UK, a lot of people are worried about it, they're slightly sceptical. What would you say to people, that it's worked quite well here?
It works well, yeah. I think so, and it's not as easy as people think it is. It's really bound by rules, so it's not like, oh, I think I want to die, and then somebody helps you.
When someone doesn't really they can't really live, I think it should be an option, but purely on what the patient wants or the next to kin.
I think that it should be legal, but only in a way we have it here in the Netherlands, because it's a very difficult process. But I think, it's for some people a beautiful way, and especially elderly people, so young people. It depends on the situation, but it's not like, I want to die.
Do you know anyone? Do you have friends or family who've gone through it?
Yes, I have.
Okay.
It was my grandma. She suffered with cancer for a very long time, and she decided, just let me sleep. No food, no nothing. Just let me sleep, so she could, pass away very peacefully. Without any pain.
Being on the streets, travelling around the country, there's a real sense that the topic of assisted dying and euthanasia have become normalised. People are very open to talking about it here, but also the issue of death itself. They speak about it very openly. One of the most outspoken in doing so has been the journalist Renate van der Zee.
I think we have a very good law with a lot of safeguarding. And also you have to bear in mind that doctors are trained to help people survive. So doctors are never eager to perform assisted dying. So doctors really need to be sure, otherwise they will not do it. My mum went through the process of assisted dying, and she had many illnesses and ailments, and she was 90 years old. And life became unbearable. I remember waking up the next day and it was this glorious summer day. And I was thinking, about my mom, and I felt really sad about the fact that she had passed. But at the same time, I was incredibly grateful that her suffering was over and that she was able to die in a dignified way, and that she wasn't forced to go through years of suffering, and that her death was painless and it was dignified and it was peaceful.
But as we saw on the streets, the question that remains here is how far the country wants to go in terms of how the law is interpreted. One of the most outspoken critics here is Professor Theo Burr. He's a professor of healthcare ethics at the Protestant University, so we've come to find out his concerns. One of Professor Ball's recent concerns has been that euthanasia is becoming a normal death and that legislation in the UK could be a slippery slope.
Once you open the door, you will not be able to close it for any new category of patients.
What advice would you have for lawmakers in the UK to not repeat some of the mistakes, as you would see it, that have happened here?
I would say one of my advices would be, of course, apart from having very strict safeguards, I would say that you also be determining that this law will not change for the coming 20 years. Make that promise. Look at Canada. The ink of the euthanasia law in 2016 hadn't even dried up. And you saw the first court cases in which I was involved, pleading for liberalization, and Trudeau, he bought it. If you have to legalize it, make sure that you will stick to this and not going any further.
There have been tragic cases such as Noah Portoven, who once inquired about euthanasia without telling her parents and eventually starved herself to death. And as we mentioned earlier, the high-profile case of Zoraya Tebik, who was physically healthy but suffering from depression and anxiety and chose in her late 20s to end her life.
It is the most tragic of all cases. For example, of Milou, the 17-year-old, her psychiatric illness was only, 5 years is long, but it was only 5 years. If you compare that in the beginning, in let's say 2010, the typical psychiatric patient had a pathology history of decades. And there's public discussion about the fact that a disproportionate percentage of those patients are young women. So what is going on with this generation? Is it despair? Is it gender? So I think we're going way too fast in this respect, and I think we should have at least an age limit of, let's say, 28. Before that, it should not be possible.
This point about young women being subject to prominent cases of assisted suicide has formed key debates in the country. Recent research found that the number of teenage girls and young women arriving at hospital having seriously injured themselves or attempted suicide has increased by 50% in the past 10 years. Meanwhile, the figures for teenage boys and young men did not increase during this time. When the law was introduced back in 2002, the number of people who opted for euthanasia or assisted dying was in the low thousands. Last year, though, 2023, saw a record number, 9,038 people, which was 5% of total deaths. Back in Amsterdam, I'm meeting Rob Jonquier, who was one of the key architects of the assisted dying and euthanasia legislation in the country.
The common sense in all those cases is that these people have been suffering unbearably and hopelessly. And on what and how, that is something which has to be destined between the patient and the doctor. And so the tool in 2010 was because it was a new territory for us. And yes, of course, making such a discussion with a psychiatric patient is difficult because you can't take blood tests or x-rays and say, you see, oh, well, this is something what's happening. Next to the big problem is that it has been muddled because the discussion started on a 70-year-old girl. And of course, there you have the combination, psychiatry, young girl, and that is something which is fire in this kind of debates. Where if you go back to what the essence of the issue is, it is a person. How old she or he is no problem. She is suffering unbearably and hopelessly, and the doctor doesn't see any possibility to take that away.
We've spent a few days in the Netherlands, and what is apparent is that this is very much a big part of Dutch culture Dutch society, people I've stopped in the street say they know friends, family who've gone through the process. People are very open to actually talking to you about the issue. What is apparent though is that experts simply can't agree on how far the practice should go, and that's a debate that could be heading to the UK very soon.